Carrie Hill. The microbe that I chose is Colostroides difficile, also known as C. diff. The drugs that are microbe resistant for C. diff is going to be like your vancomycin or your fidamoxin. They're the only drugs that can actually cure the C. diff. But the C. diff will remain colonized in the colon of the patient. The microbe, how long does it take to spread? How does the microbe spread? It actually spreads through fecal matter on the hands and on objects. And then what kinds of infections does your microbe create? It's going to be Pseudomonas colitis, PMC, toxic megacolon, perforations of the colon, sepsis, and then sometimes it'll create death, which I guess wouldn't be a infection, but you know. How lethal is the microbe? Well, it's actually lethal in about 20% of the patients. But after an appropriate course of antibiotics, usually about 10 days of treatment, with oral, or sometimes we even use IV of the vancomycin or the fidamoxin, we can usually cure it. But after we treat it, we also do not want to retest them because they are going to still test positive for the C. diff, because it's going to remain colonized in the colon, as we stated before. Another question was, why has your microorganism become antibiotic resistant? It has become antibiotic resistant because it can survive any kind of alcohol-based sanitizers. So the only way that we can actually remove it is going to be with soap and water. What is being done by medical science and others to combat your microorganism? Well, the one really, really big thing is proper hand washing. Also, we want to use, isolation patterns to make it to where we don't, spread the microorganism to others. And what can we do as consumers to combat its spread? Proper hand washing. Definitely proper hand washing. Wearing PPE when we go into patients' rooms. I cannot stress this enough. How many times we see visitors and even doctors going into rooms and not wearing the PPE. Washing your hands before and after going into a patient's room with this C. diff. Thank you.